Hi, my name is Ricardo Chacon and I am the CEO and founder of BeeMedics. Today I want to share with you what we're doing in healthcare. Let's jump in. When you have a project, or when you have an idea, there's always a need or a set of needs that you want to satisfy. And those needs that you want to satisfy define who is your market. Then you put a price on your solution, and that price defines how many people from your market can access your solution. And then you have implementation, the way that you use for your solution to access all the people that can pay for it. Now, how is it related with healthcare? In healthcare, there are 4 basic needs that need to be satisfied in order for you to create something of real value for all the stakeholders. Who are the stakeholders of healthcare? Every single person in the planet. So, which are the needs? First you have contact, then you have information, then you have work tools or tools, and then you have records. What does this mean? It means that every single person who is involved in healthcare, organization, institution, commerce, need these 4 things in order for them to be part of the healthcare world. Now, BeeMedics. Taking these needs on account, we created 4 main areas: health network, working tools, databases, and a record system. They're all connected between each other. Why? Because 49% of the planet uses the internet, 33% of the planet uses a smartphone, 25% of the planet uses Facebook, but only 0.01% of the planet actively uses an electronic healthcare system. And that is because the current systems have failed in one thing, which is integration. You have a lot of hospitals, then you have a lot of doctors or professionals that use another system, then patients, they access, depending on who do they visit, the system of each organization. So that's a problem. If you want to have everything connected in one solution, you have to satisfy all those needs in one platform. The health network is the bridge of contact between any person who is inside the platform with any provider that is inside BeeMedics too. I know it sounds general, but it is not, because every single provider can create a profile, public profile, so people can get in touch with them. One of the things that have failed, for example, in Google Health or in Microsoft Health Vault, is that they don't give the chance, the professionals, to work in the platform. So the electronic healthcare record is always more work, and professionals, they already have a lot of work. So if you double it, they're not gonna use the system. If they don't see the value, the practice value on your system, they're not gonna use it. So we created a set of tools which every single healthcare provider, listen well, every single healthcare provider, professionals like doctors, pharmacists, nutritionists, psychologists, you name it, can customize their worksheet on the system. And by doing that, we create the biggest working platform ever. They can customize not just the questions they have or the things that they want to evaluate, but also the variables. So at the end, you are creating a system that is the perfect lobby for the record system, which is the EHR. Everybody is after this, the EHR, because everybody sees the value of having patient information. Now, that can be a problem. Why? Because privacy is vital for healthcare. Because if you want a patient to use your system, for us in BeeMedics, they have to see the value in it. And not just the value, they have to have control and manage their healthcare information. It means that in BeeMedics, you share your record with whoever you want and the part of the record that you want. Why? Because if you go to a psychologist, maybe you don't want to tell him or her about an knee problem you had a year ago. Or you don't want to tell them that you are diabetic because, I don't know, it's your friend. And you have to be able to don't show that to the professional, because at the end, you are the one who manages the information. Of course, for more information a professional has, it's better for them so they can give a better attention. But that is up to you. So we believe that if we have an EHR, we want our patients to own it. Now, the record system is vital because the records is where the most value for development of new technologies, treatments, and diagnosis resides. If you go to any research, they're gonna ask you for your record. And this is vital. Why? Because it's the pure information related to your healthcare process. Now let's talk about the databases. What does databases mean? Do you remember that information is one of the needs? Well, the databases are vital because one of the biggest problems in healthcare is that people does not know which information is right and which information is wrong. and people is losing trust in their source of information. And this is because there's a lot of places where you can get information, but you usually don't know who is behind that information. The problem with that is that we're talking about healthcare. So you should not be receiving false information. There's not an actual way of controlling false information. You're always going to have people, organizations that want to manipulate the information for their own good. But if you have a place where you can get in touch with and see who is behind that information, you're gonna be closer to the truth than before. How does this relate to the health network? People, providers who are part of the health network, they can publish and write down information for their patients. Let's say that you have high blood pressure and you consume a drug. There's a lot of drugs that have been forbidden in Europe and have been forbidden in the States, and people in Latin America and third world countries, they still consume. Why? Because they don't know that. There's no way that information can be related to their local needs. Since every single healthcare provider have a profile, they can publish, so you will know who is behind that information, who is telling you if it's good, if it's bad, possible treatments, diagnosis. Now, we're gonna talk about the record system, which is vital. We in BeeMedics developed something named the Electronic Healthcare Record Timeline, which every single interaction that you have with a provider inside the BeeMedics network is registered as a post. Do you remember that the professionals had a working system? Well, they can leave you a post because they access your information in your timeline. So if you go to a doctor, on this date, a post is gonna be created with the information he shared with you, with a prescription he created, with any attached file he wants. And also, this post can be shared to another provider. Why is this important? There are a lot of doctors who work in a certain institution and then they leave, I don't know, at 12 in the afternoon and go to their private office. So while they are inside that institution, he can create a post and tag that institution to the post so they can do the billing process for the insurance company. But if he leaves the place, he's also gonna still have the post, but there will be no need for them to tag the institution. This is important because every single professional is gonna be able to carry their information with them and their practice and their working tools. It's the most mobile way of doing it. Now, I mentioned prescriptions. Let's take a minute to talk about them. Prescriptions are one of the biggest problems that every healthcare system has. Why? Because there's a lot of things that have to be registered. But since we create a post, an individual post for each prescription, a pharmacy can access it. An insurance company can access it. Another doctor can access it. When you prescribe, there's another post made. Depending on your identity, on your ID inside the system, you'll be able as a provider to see certain posts and other ones you will not be able. That's the best way to keep privacy and provide access to the provider that needs the post. Every single entry is separate from each one another. But since this is connected to work tools, healthcare network, and the databases, these posts also run through the database system where they can tell you if there's any drug interaction between each other. They can tell you which are the risks of the drug that you're getting. They can show you through the publishing system which is the latest information about the disease that you have, the prescription that the doctor sent you. Any information related to healthcare can be part of the system because of the database and the publishing. On the left side, you're gonna have patient notes. You go to a nutritionist and they're gonna tell you to write down every single thing that you ate. You go to a doctor and he sends you a specific drug and he tells you that you need to keep control of the side effects and how you feel when you are consuming that drug. So you can create those posts, tag inside the system other professionals, your professional, the medicine you take, anything related to the healthcare network of the system. So you can create value of your real experience with that thing that they are sending you. We are the first company that decided to do it this way. Record privacy is vital. It's what makes you trust the system. I don't want my daughter Emma to be part of the system where she is not the owner and manager of the information. I want her to have all her information inside a platform that she owns. How? By giving them the management of their timeline. Usually we get a question, what do they do with all their healthcare records? BeeMedics is not just a platform, it's also an infrastructure that has an open source area. So this makes the process of getting into the infrastructure and into the platform easier because people can generate APIs and apps for other systems to connect. Now let's talk about the price. Price is vital because if you want every single person in the planet to have access, you have to guarantee certain things in the price. Rule number 1 in BeeMedics: patients don't pay. It's not the advice of many financial sharks that have been our consultants, but it is vital because I want this system to be able to be accessed in every single place in the planet. And if we charge patients, you are already killing more than 70% of the people that can actually access it. Plus, is their information. Why are we going to charge patients for managing the information that is their right? Second, free basic services for providers. Every single healthcare service or product provider can be part of BeeMedics. Now, if they manage a high volume of transactions and they need a high volume of records, they will have to pay, but a little bit, not a very high price. I want every single professional to have the chance to give the best attention for their patients. And this is the way you guarantee it. By doing this, the price is not a problem for any person in the planet to be part of our solution. For the professionals that want to differentiate themselves inside the platform, there are going to be certain packages that they can pay: a platinum package, a gold package, a silver package, which you are going to be able to see on the white papers and a detailed description of the whole platform and infrastructure. You don't have every single person involved in one system. It is almost worthless because we need to create a system that fully integrates information, contact, professionals, working tools, records, and that will create a value for every single user. Now let's talk about implementation. If you want every single person in the planet and healthcare provider to be part of the system, you just don't have to create a platform. You have to create an infrastructure with an open source area. So every person or organization that already has a system can create an API and get into the system. This is vital. We're gonna create a set of tools. They can create their APIs and develop programs so they can get into BeeMedics. We're running out of time, so for another video, we're gonna talk about the implementation and the token. But now I want to talk about you. We have all lost a beloved person to a disease that we don't know if it was treated and diagnosed in the right way. It is up to create a healthcare world that we want our children to be part of. No one is gonna make this for us. We have to get involved directly with it. If you like what you saw, join. You can comment down below anything you want. You can make any questions. You can get in touch with us at BeeMedics101.com. Thank you.